Do you constantly have back pain and back discomfort? How do you know when it's serious enough that you need to start seeking help? What are the signs and symptoms that you need to look out for to know that you actually have a serious back problem? Today, in this video, this is all the topic that we're gonna talk about. So let's go! Hi, I'm Melanie the Physio, also the co-founder of Capital.Physiotherapy here in Australia. Now, it is estimated that 80% of the population would experience some sort of back pain throughout their life. So how do you know when is your back pain serious enough that you need to start looking for help? In most cases, lower back pain is caused by mechanical origin. That means it's not something sinister, it's not hereditary, it's mostly because of environmental issues. Environmental issues as if things like poor lifting technique, sitting for too long, poor ergonomic setups, and things like that are generally the root cause of lower back pain. Now, the following signs and symptoms that I'm going to mention for different stages of back pain are not exclusively just this symptom. These are just some of the most common symptoms that we see in different stages of lower back pain. So the early and most common sign of lower back pain are just general stiffness of your lower back. It doesn't even have pain per se. Like, people just feel stiffness or tightness in their lower back. Most of the time it's like early in the morning when they wake up they feel stiff, or it's like at the end of the day after a long day of work that they start feeling stiff. But a lot of these symptoms generally dissipate by themselves if they just leave it as it is. They may be just some mild pain, but most of the time it's just stiffness, especially sometimes just a certain movement. Sometimes it's not even every morning they'll wake up with stiffness, it's just they will feel the stiffness when they're doing certain activity. So a lot of clients at early stage of lower back pain will come to us and say, I only have back pain when I'm playing golf. All the other time is actually fine. Or they'll say things like, I'll only have back pain when I'm sitting for too long. Every other time is actually fine. So these are the mild and early stages of lower back issues. A lot of the time these discomfort are not severe enough that it's bothering the person. They're just aware of it, but they're doing most things, they're doing most sports. It's not really limiting them in doing anything that they want to do. But these symptoms will be persistent for months and months, at least 3 months, that they will have all these on and off symptoms like morning stiffness, or every time they play golf it hurts, and after 3 months it's still every time they play golf it hurts. So the discomfort doesn't really go away. So when we hear people describing these sort of symptoms to us, the first thing that me as a physiotherapist, I would think of a few things in terms of the treatment. Is that this is an early stage of lower back issues. Is your body trying to tell you something is not right? That's why you have the stiffness symptom to begin with. Something is not working properly, and it's the start of your discomfort. And on top of that, not only are you not supporting your back properly, you are putting excessive load on the joint as well, due to whatever activity you're doing that's causing the stiffness. So the first thing I'll think of is we need to offload that spine. We need to find out all the triggering activity and modify them and change them so you're not really loading those joints over and over again that's causing that stiffness discomfort. And the second thing we will then look at is the underlying weakness that is causing the stiffness to begin with. Like, something is not working properly in terms of your muscle control, that then in turn puts a lot of load on your joints because the muscle is not absorbing the shock. That's why you're feeling the stiffness. So then in treatment, we need to find out where the weakest link is and start training them up. If it's persistent over months of the same symptom, even though the discomfort is very mild, it's your body telling you something is fundamentally wrong. At this stage though, the rehabs are generally pretty quick and pretty short and effective if you follow through properly. And most people at this stage will almost get 100% recovery with no long-term issues. Rarely do we see people with back pain at this stage, because most of the time a lot of people would just think that it's nothing major and they would just leave it. And because the symptoms are not constant every day, it's only when they do certain things, they would then just try to avoid doing those things or try to modify doing those things, but they're not really treating the fundamental root of the weakness that's causing this problem to begin with. So we rarely see people at this stage of the back rehab, which is a shame, because this is actually the stage that's the easiest to treat and the shortest time frame to treat them properly and effectively. Now, if you leave it and do nothing about it in the early stage, your lower back pain will most likely slowly progress to the moderate severity of lower back pain symptoms. So the common sign and symptom at this stage is that people will start actually experiencing proper pain. So they will have acute episode of back pain where they wake up with the back pain, but then very quickly after 2 or 3 days, it just gets better itself again, or they will take some painkillers and then it gets better on its own. This is the stage where people actually experience true pain instead of just tightness and stiffness sensation. The pain is enough for them to feel probably not severe pain, but moderate enough for them to start watching and be careful of what they're doing with their back. So some people at this stage will then start to watch out what they do to avoid having that pain symptom, but they do experience pain, but the pain is not severe enough for them to totally not do the activity. So if they are willing to push through with the pain, they can still most of the time do everything that they want to do. So they can still do the sports, albeit a little bit of discomfort, they can still actually do those sports. This is also the time that people will start experiencing night discomfort and night pain. This is the first sign of inflammation, that something is actually swelling, you're irritating it enough that it's causing like inflammation response now. And this is the stage where the pain is generally not just at the lower back anymore. It can go across your whole lower back and sometimes even down to your bottom area, sometimes also going all the way down, but never really past the knee area. Yeah, so at this stage, more commonly people would tell us if they're at this stage of their lower back pain, they will say something like, every time I run, it will hurt during and after the run, and it will hurt that night, but then the next day it's okay again. Or they will say, Sunday I wake up with a really bad pain. Or they will say something like, Sunday I just wake up with a really bad back pain and just take a few painkillers, it's much better now, but I can still feel that the back is not quite right. So when I see client at this stage, what I normally think is that, okay, there is an underlying cause that is causing them to not stabilize their back properly, to not control their back properly. That's why they're loading up the joint. And it's not just loading up the joint that's causing the discomfort anymore. They're irritating, they're loading up the joint so much that it's starting to cause some irritation on the lower back spine itself, that is starting to create some swelling and some inflammation. That's why they're feeling this night pain. That's why they're actually feeling proper pain rather than just like a stiffness or discomfort. So then at this stage, when we see clients at this stage, we normally then have to not just fix the mechanical offload anymore, we have to first fix the inflammation first. So then we have to fix the swelling first, then we fix up the loading, how they load that's causing the pain, and then lastly we target the weakness area to fix this root of the problem once and for all. If we see people at this stage of the rehab, the prognosis is still pretty good, albeit it's going to take a little bit longer than the previous stage, because now we have another layer of inflammation that we have to deal with before we look at the loading, before we look at the strengthening. But most of the time, if they follow through the whole rehab process, they will still almost have 100% success rate of full recovery with no long-term issues with their lower back. In this channel, we have a whole playlist dedicated for lower back pain. Even though the title might not suit you, I still highly recommend you check them out, because I'm sure there will be tips and exercises in those videos that's going to be helpful for you right now. Now, when you're in the severe cases of lower back pain, the most common signs and symptoms are people would have experienced a few episodes of back pain already, but it sort of recovers itself, or they will go to the physio once or twice and then the pain will be gone and then they move on with their life instead of going through the entire rehab. They would have this episode of really, really bad back pain. Sometimes it's bad enough that a lot of our clients would actually end up in the emergency department because it's so painful, and the emergency department would just do a scan on them and then they would just give them some painkillers and then send them home again. So these are the people that will come in and said that they have back pain before, they've experienced back pain before, but it was never this bad. Now, this sort of acute pain is severe enough to normally last for about 2 to 8 weeks. So you would have some sort of pain for about 2 to 8 weeks. That's quite moderate to severe. Now, after those 2 to 8 weeks though, they will still have residual, a lot of stiffness, a lot of weakness, even mild pain persisting for months to come after that. Now, if you're at this stage of your lower back pain, you will most likely experience like stiffness in the morning, stiffness at night, or just stiffness in your back as long as you're not moving. So if you're standing for too long, sitting for too long, lying down for too long, when the moment you moved, it will be really, really uncomfortable and stiff. Now, these group of people, when we normally see them in their clinic, because they have experienced such an episode of like pain, they are quite fearful of moving their lower back. They will be very, very apprehensive with every movement they do with their back because they don't want to experience another episode that is so bad that they have to go to the emergency department again, or so bad that they're bed rest for like 2 days that couldn't even move, So they have that fear in them already that makes them be very, very cautious with every single back movement that they're doing. Most of the time when you're at this stage of your lower back pain, we commonly hear people say that I feel like I have to stretch all the time just to feel normal-ish. Like it's not even normal, but they feel the need to constantly stretch to actually be functional or be comfortable enough to be functioning. Now, at this stage, they may or may not have pain that's going all the way down to their leg. So not just the bum, not just the knee anymore, it goes all the way down to the entire leg, sometimes with nerve involvement as well. So they will feel pins and needles down their leg, or they will feel like numbness in their legs instead of the back. So sometimes they would feel that the pain is actually constantly in their calf or in their leg instead of an actual back pain symptoms. This is what we call sciatica. And sometimes they might not have a really bad episode of back pain. They might just wake up and then it gradually just feel like they constantly have these nerve symptoms that's going down their legs, like all the way down to their calf, numbness down their legs now. Now, when I hear people describing this sort of symptoms to me, I would categorize them to be on the more severe side of lower back pain. And unfortunately, these are actually the cases that we've seen most commonly in our clinic on a daily basis. This is when people would actually come and seek help. When I see a client at this stage, the treatment would be very different from the first 2 stages already. So when we see clients like that, the first line of treatment that I would do is actually fear management, to actually reassure them. A lot of fear management, a lot of education, a lot of reassurance that the pain that they're feeling is okay at this stage. And there are things that we can do. They're probably not going to go away straight away. They're going to be staying there for months and months to come, but it's okay to still move your back with those pain that they're experiencing right now. It's not going to re-trigger the pain again. It's not going to get as bad as the need to go to ER again. At this stage, it comes down to a lot of education already, educating them, giving them a realistic time frame to think of as recovery. Because when people come in and they have pain on Sunday, they have to end up on an ER and they give the pain management. They don't expect coming to the physio and the physio say your rehab is going to take about 6 to 8 months. They never think that it's going to take that long. They would think that it's probably going to last for 2 to 3 weeks, 4 weeks maximum. No, it takes about 2 to 8 weeks for the pain to even go away, for us to actually start rehabbing all the underlying issues. So sitting down with a client at this stage and then letting them understand the process and a lot of education and giving them realistic prognosis and realistic time frame is what we do a lot at this phase of the rehab. Unfortunately, for clients who have reached this stage of their lower back, there's really no other option than to really follow through with the rehab because their back is severe enough that is causing them proper discomfort in their day-to-day activity, and if left untreated or not rehab at all, they would most likely end up with more invasive interventions such as surgeries and things like that. So at this stage, when people come to me at this stage, I would say that rehab is no longer a negotiable thing, it's a necessity now. So if they don't do it, it will most certainly get worse. At this stage though, unfortunately, there's also a higher percentage of people that actually don't fully recover even after the full rehab. Now when I say fully recover, I mean that they would probably never live their life like completely symptom free. So even if it's just a very minor symptom, such as just every time most of the things are fine, they can work, they can play sports, but every morning they wake up, their back is just stiff for a while until they warm up. So these are some of the, unfortunately, symptoms that will persist and probably persist for a long time to come when people is rehabbing at this stage of their lower back problem. The prognosis to be completely symptom-free become much lesser compared to the first two stages. But then same thing, we're gonna fix up the pain first, reduce the massive inflammation first, which is gonna be quite hard compared to the last stage. The inflammation process again is going to be longer, it's going to drag out a little bit longer, to manage it is going to be longer as well, and then we need to fix the loading issues, and then we need to now sometimes need to fix the nerve involvement as well. Then only we can move on to like the strengthening of everything and things like that. So there is just more and more layers of complication adding on every stage we go that we need to peel them off one by one to actually treat them properly. And then after that, you thought that was the severe cases already. No, then we have these urgent cases that need medical attention immediately. So if a person is experiencing pins and needle and numbness down their legs, pain, constantly lacerating pain down their legs all the time, if they start to lose control of their foot control, or if they start having bowel and bladder issues, these are the patients that we will send off to the ED or to the GP or to the surgeon straight away and get them sorted medically first before they then come to rehab with us. If you find value out of this video so far, make sure you hit the like, subscribe and bell notification button right now, because the more likes you click, the more YouTube will share it to the rest of the world and the more people we can help with lower back issues. As a physiotherapist, of course, I encourage people who start having the first earliest sign of symptom to seek help instantly, because the longer you drag it on, the harder and the longer it's going to take to rehab, and the success rate just gets lesser and lesser as the symptom progress. I hope that this video will help you understand a little bit about the different stages of lower back pain, and to understand that actually every stage you would need to see physio, and if you have even the earliest sign, it's something that your body is telling you like something is not working. It's the earliest sign, so don't ignore it, because if it's a muscle strain or if it's something minor, they would have they would have just healed itself, or you wouldn't feel this repetitive common symptom lingering on for months to come. Even the early stages, you will have stiffness for months that doesn't go like that, that's on and off, but it's persistently for months and months to come. That is the sign that your body is telling you something is not right and you need to do something differently, or you need to start seeking help and just fix this, because something is fundamentally not coping in your body. I upload video here on a weekly basis on health and fitness related topic as well as injury rehab topic. Once again, I'm Melanie and I will see you in the next video. Until then, stay safe, happy and healthy. See ya!